Hey guys, and welcome to How to Gastro. In today's video, we're going to be talking about a very interesting topic, and that is Mansonellosis. So let's get started. So what is Mansonellosis? Mansonellosis is a parasitic disease which is caused by one of three species of a filarial parasite called Mansonella. The species include Mansonella ozardi, which is a parasite of man in Central and South America, Mansonella persistans, which is a parasite of humans and primates in Africa and in South America, and Mansonella streptocerca, which is a parasite of humans in Africa, all of which use humans as their main definitive hosts. These parasites are transmitted to humans by blood-sucking midges, which are small flies that develop near swampy areas, and it is estimated that more than 100 million people worldwide are infected. So from this definition of Mansonellosis, we get that it's actually divided into three main species, and we have those three main species which are found in very specific areas, most commonly South America and various parts of Africa. We also get from this definition that the human is actually the main definitive host of this infection, and humans become infected by these blood-sucking midges or flies, and they are usually found near these swampy areas. So if we take a closer look at this image to the left of my screen, we see what the various species actually look like. So we have Mansonella persistans, which is pictured in A1 and A2. We have Mansonella streptocerca, which is pictured here, and Mansonella ozardi, which is pictured here. And then we have the various countries which are actually affected from this disease. So now that we know what the basics of Mansonellosis is, let's take a closer look at how one can contract this disease. So as we mentioned in the slide before, the infection is brought to humans by these blood-sucking flies or midges, which are found in the various swampy areas in these countries. So we'll start at number 1, where it says during a blood meal, an infected midge introduces third stage larvae into the skin of the human host, where they penetrate into the bite wound. So we have this midge which takes a blood meal from the human and hereby deposits these L3 larvae into the bite wound. These larvae then develop into adults that reside in the body cavities, mostly in the peritoneal cavity and pleural cavity, and less frequently in the pericardium. So we have the adults which now invade the peritoneal, pleural, and pericardial cavities. And it says the size of these female worms is about 70 to 80 millimeters, so about 7 to 8 centimeters in length, and about 120 micrometers in diameter. And the males are slightly smaller, measuring approximately 45 millimeters by 60 micrometers. And then we have the adults which produce these unsheathed subperiodic microfilaria which enter the peripheral circulation. So now we have these adults which produce these microfilaria that reach the bloodstream of this patient and the peripheral circulation. So a midge vector ingests these microfilaria during a blood meal. So now we have another midge coming along and biting this human and thereby actually ingesting these microfilaria that's found in the bloodstream of this human, and actually this new midge becomes infected with this disease. So it becomes a carrier of this parasite. So after the ingestion, the microfilaria in this midge migrate from the midge's midgut through the hemocoel and to the thoracic muscles of the arthropod. So now we have these microfilaria which penetrate the midge's midgut and migrate to its thoracic muscles. And there we have the microfilaria which develop into first stage larvae and subsequently into third stage infective larvae. So now we have the first stage larvae and then we have the third stage infective larvae. And then the final step in the cycle is when the third stage infective larvae migrate to the midge's proboscis, which is the point at which it goes in to bite the human, and can now infect another human when the midge takes a blood meal. So now we have this infected midge, which when it takes a blood meal from the next person, it can actually go on to infect them. And so the cycle continues. And this is how the humans become infected and the midges become infected. And it's just sort of a ping pong between the two. And we have the infection of more and more people over time. So now that we know how one can contract this disease, let's take a closer look at some signs and symptoms of this disease. So most patients will have non-specific symptoms, which include pruritus, which is itching, urticaria, arthralgia, abdominal pain, and fatigue. But more specifically, in Mansonella persistans infections, the symptoms of the infections are probably related to the migration of the worms and include transient subcutaneous swellings, which are similar to the calabar swellings, which are caused by lower. So as we discussed in my previous video on the lower infection, we spoke about these calabar swellings. So patients who suffer from this Mansonella persistans infection also develop these calabar swellings. These patients will also develop pericarditis, pleuritis, and inflammatory granulomatous nodules which surround the dead adult worms. So in the Mansonella ozardi infections, even though it is usually described as relatively harmless, it has been associated with keratitis. And this is actually the inflammation of the cornea of the eye. And finally, in the Mansonella streptocerca infections, this infection is very similar to the onchocerciasis infection in the sense that the patient here will develop a papular dermatitis and a pruritus, which is itching which predominates on the upper part of the body, and it also has the absence of the nodules. So we have this papular dermatitis and very itchy skin which predominates. So how can one go about diagnosing Mansonellosis? So examination of the blood samples will allow identification of the microfilaria for the Mansonella persistans and Mansonella ozardi, and the diagnosis can be made on the basis of the morphology of the nuclei distribution in the tails of the microfilaria. So these are actually what the microscopic aspect of the M. persistans and M. ozardi infections look like, and we'll take a closer look at the tail sections of these microfilaria. And we can see the nuclei distribution in these two areas, and this can be used to help us to diagnose this disease. So we can also do the examination of skin snips, and this will identify microfilaria of the Mansonella streptocerca infections, and the skin snips can be obtained by using a corneal scleral punch or more simply by a scalpel and a needle. And this is what the typical microscopic aspect would look like. And then to help us in this diagnosis, we can also do a simple blood test, and here we will see elevated levels of the eosinophils. So we'll have hypereosinophilia, which will be noted on the blood test. And the eosinophils are a type of white blood cell that are usually found in increased amounts in patients who have a current and ongoing parasitic infection. So this can be helpful in the diagnosis as well. And finally, let's talk about the treatment of Mansonellosis. So the most commonly used drug to treat this infection is diethylcarbamazine, which is commonly known as DEC. However, a combination of treatments which include DEC plus mebendazole was shown to be much more effective than single drug doses. And that brings us to the end of this presentation on Mansonellosis. Thank you guys so much for watching. Hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe, and share. And please make sure you turn on your bell notifications so you'll be notified every time we have a new upload. If you'd like to download a copy of this presentation, you may do so by clicking the link in the description. Take care and bye for now.